You wouldn't give your baby alcohol, would you? But if a woman drinks while pregnant, that's exactly what she's doing. 3-year-old Jacob suffers from fetal alcohol syndrome because his mother drank alcohol while she was pregnant. Sadly, Jacob is not alone. Each year in the United States, an estimated 2,000 to 6,000 babies will be diagnosed with fetal alcohol syndrome. Even more staggering is that nearly 40,000 babies are born each year with fetal alcohol spectrum disorders. This is a term used for those who may not have all the signs of fetal alcohol syndrome, but still have one or more of the serious physical and mental defects caused by drinking alcohol during pregnancy.
Most individuals who are exposed to alcohol prenatally don't demonstrate the full fetal alcohol syndrome. They actually can demonstrate significant effects, though, from that alcohol exposure prenatally. There could be significant learning problems, there could be attention deficit hyperactivity disorder, there could be behavioral disorders. And this area that we call the fetal alcohol spectrum disorder involves many more people than those who have the full fetal alcohol syndrome.
Drinking alcohol during pregnancy is the leading cause of intellectual disability, developmental disabilities, and birth defects, and it is also the most preventable cause. A woman only needs to simply avoid all alcohol when she is pregnant. When a pregnant woman drinks alcohol, her baby's heart, liver, kidneys, brain, and other organs may be damaged.
The diagnosis of the full fetal alcohol syndrome requires the presence of 4 specific findings. One is that there has to be growth impairment, and that would include the height and weight below the 10th percentile. There should be evidence of neurologic impairment such as microcephaly, significant learning problems, attention deficit disorder, behavioral difficulties, and there have to be specific facial features. In particular, small palpebral fissures or the width of the eyes are smaller than individuals who are at a similar age and below the 3rd percentile. The philtrum is smooth. This area between the nose and the lip that is typically indented is smoothened in individuals who have been exposed to alcohol prenatally. And also the lip itself doesn't have the typical philtral indentation, doesn't have that Cupid's bow appearance, and is smooth and thinner than usual. And then lastly, of course, there has to be significant exposure to alcohol prenatally.
It's important to realize that there is no cure for fetal alcohol syndrome. Its effects last a lifetime. Parenting a child with fetal alcohol syndrome is a long and difficult task.
Because he is extremely delayed on speech. Jacob does not speak. He does a little bit of sign language, so that's one of the major challenges right now, is the fact that Jacob can't communicate. So he gets frustrated and then he gets upset. He comes first with all of his needs, with occupational therapy, physical therapy, an early interventionist. He has epilepsy, so we have doctor's appointments and stays, stuff like that. So a lot of visits, a lot of doctors.
The good news is that fetal alcohol syndrome and its negative effects can be completely prevented by avoiding alcohol when a woman is pregnant or could be pregnant. From the very beginning of pregnancy, everything a woman eats or drinks is shared with her developing baby. Alcohol is absorbed into her bloodstream and spreads throughout the body. It passes through the placenta and directly into the baby's bloodstream, where it may damage the baby's forming brain, body, face, and organs.
The concept of no alcohol at all during pregnancy is supported by various organizations, including the American Academy of Pediatrics, the American Association of Family Physicians, American College of OB/GYN, and the Office of the Surgeon General. So really that's across the board. We're all in agreement that there is no safe amount of alcohol during pregnancy.
Doctors and healthcare providers agree that alcohol should be avoided during the entire pregnancy, not only the first months of pregnancy. Women who are pregnant, planning a pregnancy, or having unprotected sex should avoid all types of alcohol, including beer, wine, wine coolers, and liquor.
If you look at pregnancies in the United States, 50% of them are unplanned. That means that 50% of women aren't thinking about the amount of alcohol they're taking in and have the potential to impact a pregnancy. A lot of these women aren't going to know that they're pregnant until they're several weeks along in the pregnancy, and by then they really can have already had a detrimental effect to their babies.
The only safe answer to the question of how much alcohol is safe is that no amount of alcohol is safe. We really do not know of a minimum amount of alcohol that is going to be safe for that particular fetus and that particular pregnancy at that particular time.
If a woman is pregnant, she may stop drinking at any time to increase the chances of a healthier outcome and limit the damage caused to her baby. Leah, the mother who adopted Jacob, knows all too well that alcohol and pregnancy do not mix.
This is the one disability that I know of that's 100% preventable on our part, because if you don't drink, they don't have the disability. And so just don't, going through what I go through, I don't want anybody else to go through it, and I don't want another child to have to go through it.
I think one of the things that we need to realize is that with alcohol being one of the leading causes of birth defects, mental retardation in the United States, this is something that is preventable.
To learn more about fetal alcohol syndrome and fetal alcohol spectrum disorders, talk to a healthcare provider or call the Pregnancy Exposure Risk Line at 1-800-532-6302. If a woman is drinking during pregnancy and can't seem to quit, she can get help by talking to her healthcare provider or by calling Smoky Mountain Center, the local mental health center in Western North Carolina, at 1-800-849-6127. In Buncombe County, she may call the Western Highlands Network at 828-225-2787. Healthcare providers or these resources may assist with a referral to a substance abuse counselor. Remember, when a woman shares her body with a baby, there is no such thing as a safe drink. For a healthy baby, take your daily multivitamin, eat healthy foods, and be an alcohol-free mother-to-be. This video is made possible by the Fullerton Genetics Center at Mission Hospital through a grant from the March of Dimes. Learn more about the March of Dimes on the web at marchofdimes.com.